And we are live. Hello, tribers. Can you see us? Please let me know in the comments. Click on the like button. If you can see us, let me know. If you can hear us, let me know. Yes, here we are. Okay. So today is going to be a very, very interesting session. Please stay tuned. Please tag all the friends who would be interested in this session. And the topic for today's session is dehydration in children. And to shed some light on this topic, we have with us Dr. Santosh Kumar K. Dr. Santosh is a consultant neonatologist and a pediatrician, having an experience of 8 years working in some of the best neonatal and pediatric care hospitals in South India. Currently working at the Motherhood Hospitals, Banashankari. Before moving to Motherhood Hospital, he had a 2 year stint at Exclusive Children's Hospital, Bangalore. He obtained his MD Pediatrics from Kempegowda Institute of Medical Sciences, Bangalore. He has gained extensive training in neonatology in last 4 years with a fellowship in neonatology from Indian Academy of Pediatrics. He did his fellowship from the prestigious Sri Ramachandra University, Chennai in 2015, a 60-bedded level 3B unit in the country. He is one of the national instructors for advanced NRP and has got accreditation of Bailey and the C scale for development assessment. Welcome to the session, doctor. Do you have any opening thoughts for the day? Are you able to hear me, doctor? Oh, I think we have lost him. Let's please wait for doctor to rejoin. We have some network issues today. So let us please wait and see if he's able to rejoin this session with us. In the meanwhile, I would like to inform all the viewers that the topic for discussion for today is dehydration in children. Samya, if you could please see, check on. Doctor has dropped out of this session. He's back.
Yeah. Yeah, I think there's some network issues. I don't know what the concerns are.
Yeah. No, that's okay. That's okay. So, welcome to the session, doctor. I'm
Thank
glad that you could take out some time and be with us here today.
I thank SuperBottoms for this opportunity. I'm very happy to share my inputs on dehydration today in children.
So, doctor, what are the signs and symptoms of dehydration in children? When should parents be worried?
Yeah, so basically we see a lot of dehydration in children during the time of summer. So the most common cause is either the child having diarrhea or vomiting or excessive activity leading on to sweating and that leading on to dehydration. So if the child has got very limited amount of symptoms, that means a frequent thirst asking for fluids, or if the child has got any of those symptoms of diarrhea or vomiting, and if the child has got a very high level of activity leading on to sweating and all those things, they'll exhibit a very minimal symptoms of frequent thirst, less amount of urine output in case of no dehydration. Whereas in some dehydration, they will have less amount of urine output, they'll have frequent thirst, they will be little irritable, they will be little fussy on every small thing, their activity will not be normal as it used to be. These are some of the symptoms the child will present. Whereas when a parent looking at the child in depth, the parent will understand the child sunken eyes, there will be dryness of mouth, skin turgor, I mean the skin softness or the pinchy skin going back to the normal position will take more time, and you will not be very cooperative in terms of taking feeds, refusal of feeds, and there are some signs which the parent can elicit if the child is dehydrated.
Okay. And how many peas should a child have? Say, an infant or a toddler. What should be the count of pee that parents should be mindful of?
Again it depends, but normally I think a normal infant less than 1 year of age should have at least 6 to 8 peas in 24 hours in 24 hours, whereas a child who is between 1 to 3 years can have around 4 to 5, and child above 3 years can have at least minimum of 2 to 3 episodes in 24 hours.
Okay. When should parents be concerned about a child's dehydration?
Yeah, again, now the background of this is whether the child has any symptoms of diarrhea, vomiting, fever, or excessive sweating, or anything leading on to the child not taking any foods, very irritable, doesn't want to take, is not able to intake any fluids, and is vomiting for at least minimum of 6 to 8 hours of duration. I think the parents have to be concerned about it, and they have to have a doctor's opinion in those situations.
Okay. And what are the ideal fluids that you can give to a child to ensure that the child is rehydrated quickly?
Yes. Now, suppose a child who has got any of the symptoms that may lead on to dehydration can exhibit a minimal amount of the basic, what we call as no dehydration or minimal dehydration, where they'll be having frequent thirst, less amount of urine output, and little refusal of feeds. In those cases, they have to give liquids. And when I say liquids, a simple oral dehydration therapy, what is required is basically they lose the salts and they'll have less low sugars. So the composition of simple preparation of 1 liter of water, to that add 6 spoons of sugars, half spoon of salt, mix the solution at frequent intervals. If they consume this should be more than enough for the child to be rehydrated in minimal dehydration children. So, for
Okay.
example, a child who is less than 1 year can take at least every episode of loose stools or vomiting should consume at least 50 ml per kg or 500 ml per day.
Okay. Right. And on a routine basis, for example, during summers, right, the child is
Yes.
going to go out in sun, or maybe just due to his own activity, the child is going to get dehydrated a little. What is the normal amount of water a child should be drinking on a day-to-day
Again,
basis?
yes, I think that is also very important. Again, it depends on the age of the child. At least a child who is less than 1 year should at least less than 3 years at least should consume 1 liter in a day. Between 3 to 6 or 3 to 8 years of age, they should at least consume around 2 liters to 2.5 liters. And children above 8 years to 14 years or 15 years should consume around 3 to 3.5 liters of liquids in a day. In terms of all the food components and liquids together put together.
Right. Yeah. So it's not just the bottled water, but all the liquid
No,
going through the food as well.
going through yes, yes.
Right. Are there any complications that a child might face due to dehydration?
Yeah. Now, again, when it comes to dehydration, as an pediatrician or a neonatologist, what I look into is when a child comes to me with the complaints of dehydration, vomiting, or diarrhea, what I see majorly see is based on my assessment of clinical examination, how much the child has lost the fluids. Now, based on that, we differentiate them into less than 5% or probably between 5 to 10% or more than 10%. So, what we call less than 5% is called as mild dehydration. Between 5 to 10% of the weight loss can be considered as moderate dehydration. More than 10% is considered to be severe dehydration. When severe dehydration happens, now our body normally is consisted of 30 to 35% of water, total water content. In that, we have two components, something called as outside the internal organs and inside the internal organs. Now, these fluid shifts. Now, whenever I'm very much dehydrated, that means either my sodium will go very low or sodium will be sometimes little on the higher side based on what we intake. So they can
Hmm.
can directly impact on the brain activity. That is why always whenever a child is irritable or a little cranky or fussy, you should always think of dehydration. Second thing is again gastrointestinal symptoms, then your cardiac functioning, the pumping of the blood from the heart, and your respiration. So all the components of the major organs like your brain, your lungs, your heart, and the gastrointestinal system gets affected. So that may lead on to a lot of children getting into hypovolemic shock, or the droplets of the salts, the sodium salts and the chloride salt, bicarb salts, losing them, and that may lead on to some electrolyte imbalance affecting the brain functioning. So it is a very serious complication and should be treated at the earliest.
Okay. And is dehydration a sign of any underlying health condition in children?
Again, it is not a sign of any underlying health condition, but most commonly dehydration and your gastrointestinal system your goes hand in hand. So if the child has got any illness corresponding to the gastrointestinal system, mainly the vomiting, diarrhea, or failure to thrive, that what I mean to say, not gaining weight or malabsorption, can have dehydration.
Okay. Often we see, when a child is having a bout of vomiting, or because of any illness, the child is vomiting continuously. Then they refuse to have anything. They refuse to even drink water at times. So giving
Yes,
ORS or any other oral rehydrating solution becomes very difficult, and they don't retain anything once they consume.
true,
So are
true.
there any solutions to go around that condition?
Yeah. So the basic first principle in those situations is do not force your child. Either if you're very nearby to your physician or your pediatrician, just reach them out to them, let them see, because there is some amount of reflux that is going on because of an infection or because of an indigestion. So during that point of time, if you try to push fluids or anything inside the baby's body, it will try to take it out. Again, the baby gets tired too much. So at this point of time, the best solution is to start at small aliquots at frequent intervals. That means you don't have to load around. Say if a child is around 1 year, you try to give at least 50 ml, 100 ml at once. Instead, give 10 ml at frequent sips. Wait, watch, and in between, in the meantime, just try to consult a pediatrician. And there are some medication that is given to immediately, instantly stop these vomiting episodes. That can help the baby to get back to normal intake of fluids. So the
Okay.
basic mantra is whenever the child has got repeated episodes of vomiting, do not force feed, do not forcefully give liquids to baby. Instead, give time, allow the baby to settle down, use small aliquots, frequent intervals, small amount of liquids at 10 ml, 15 ml liquids at frequent intervals.
Okay. Also, one question we had in our community was, are the oral rehydrating solutions? So there is ORS, and there are also specific sports drinks that people often consume for rehydration, as in the advertisements, not
Yeah.
recommended
Yeah.
by anyone, but the advertisements say that you can have those for rehydration in adults. So are
Yes.
the normal sports drinks safe for kids to consume?
Again, certain sports drinks are not safe for children to consume because they are prepared in a certain expectations of how much dehydration the sports person might go through in that particular part of time. So here children, the cause might be different, and you should not consume them because any high amount of intake of sodium salts or any high amount of intake or low amount of intake of glucose can lead on to other complications. So it is advisable not to take them. A simple solution is just what we explained: a liter of water with 6 spoons of sugars and a half spoon of salt is one of the best oral rehydration solutions, where it has got a low osmolarity, exactly required for the amount of sufficient amount of salts and some sufficient amounts of sugar that is required for the rehydration one. Otherwise, you can see a simple tender coconut water can be consumed. It has got electrolytes, or basic fruit juices like apple juice, equal amount of water mixed in that can be consumed. These have a very low amount of fiber, so it doesn't disturb the metabolic or the digestion factor of the intestine. So there's some simple solution that you can follow: liquids.
Okay. Are there any points that we have missed out on that you would like to shed some light on with regards to dehydration in children?
Yes. So normally, whenever a parent see what in my office practice, at least now in the summer, I think probably in last April and May, I would have seen at least 10 to 15 patients coming with symptoms of diarrhea, vomiting, or child being little lethargic, dehydration, coming to my office practice. Now, what will happen is during summers, child tend to have lot of dehydration because either because we know that whenever there is summer, there is scarcity of less amount of water consumed, where more than the required amount we are consuming a less amount of water. The children easily get have this dehydration. Secondly, there are a lot of bacterial and viral growing up during the summer season because of laxity of water, where they cause some amount of infections in especially in children. So whenever there is a child who has got some dehydration, diarrhea, and vomiting, what we have to understand is that it is quite common for children to have diarrhea, and it cannot be instantly stopped. So what you have to do every time the child passes the amount of stools, just have to rehydrate them with some sort of solutions, liquids. So that will help them to maintain the hydration. In the meantime, you can always ask for their doctor's opinion to give what medications to be given. Normally in children, we do not give any medications other than simple replacement of zinc supplementations and some amount of oral rehydration solutions. And if you feel it is a bacterial infection, we treat them with antibiotics, or else we just give them a probiotic with zinc and some basic hydration solutions. So these are essential things, but this will not stop your diarrhea, because most of the diarrheas or dehydration caused by vomiting and diarrhea is viral in nature. So viral is self-limiting. It will take its own time, point of time. Some viruses can take 3 days. Some viruses can 5 days, take 5 days. So you should never get panicked, because I see most often see in my office practice, a patient has gone to multiple number of doctors within a short span of 2 days, 3 days, and then comes back to a fourth doctor asking them, with it's been 3 days, still the flu stools are not stopped. So naturally, when it is viral, it is self-limiting. We do not treat the virus. We just treat the symptoms of the child. So parents should understand whenever there's a dehydration caused due to this vomiting or diarrhea, just try to rehydrate them. What we can do as a physician, as a pediatrician, is try to prevent vomiting and try to at least slow down the process of loose stools. So good amount of nutrition, good amount of hydration with fluids that are recommended during this phase of dehydration will help the child to gradually recover. Only thing as a parent, what you have to look into is that make sure that a child doesn't get dehydrated. Make sure that the child takes at least some amount of liquids at frequent intervals. Make sure the child is passing good amount of urine, and the activity of the child in between is absolutely normal. So if you come across the activity of the baby is not good, the child is very irritable, very fussy, doesn't sleep, doesn't eat, doesn't spend his normal activity as usual, or if the child is not at all taking anything orally for more than 68 hours of time, or if the child has not passed urine in last 12 hours, and you see the child always lying down with less amount of activity and majorly fatigue, then these are the four situations where you have to consult your doctor, and the child might require immediate intervention and to address his dehydration concerns.
Okay. Okay. Let's now quickly take some viewers' questions we have. One viewer says, "Hello, doctor. My son often says there is pain in his private part and there is a white sediment on his private part. Is this normal? I'm regularly cleaning his private part though."
Okay, this is one of the common concerns. See, again, in an office practice, normally the genital examination should happen at 6 months, 9 months, or at 1 year of age. Now, why is genital? This thing is primarily something called as phimosis, where the preputial skin will be little tight in children. So as the age goes by, the infant's age goes by 6 months, 9 months, the skin has to loosen up. If the skin is not loosening up, that can lead on to the local infection of the prepuce or the urinary tract infections. Now, if he's frequently complaining of pain, that means he's not voiding his urine completely. Now, why is he not voiding his urine completely? Because either the skin tight would have caused the child to not completely void the urine, or there will be a dripping of urine at frequent intervals, which may cause a localized infection. So you have to consult your doctor, get it examined, and see if the preputial skin is normal, whether it is retracting back to normal position, going back and coming forward to the normal position or not. If not, if the child is more than 1 year, it requires an intervention.
Okay. The next question is, it is said sugar is bad for brain and body, especially for babies. Any option for that other than sugar? I believe they're referring to the rehydration solution that we suggested.
Yes. Again, rehydration solutions. Now, WHO recommended solutions. What we used to use in olden days are a little bit of high sugars and a little bit of high sodium. Now we get something called as low osmolarity solutions. Again, here we are not overloading. Now there's a cutoff for children of different age at how much fluids they should take. For example, the ORS solution is only recommended after 6 months. So less than 6 months, you don't give oral dehydration solutions. Only after 6 months. Again, after 6 months, based on the weight of the baby and the amount of stool that the baby child is passing, you can decide. We doctor decide how much fluids should be given. Now it is in the normal range of acceptability and it doesn't cause any harm. It can be used after 6 months.
Okay.
Children
The
and
next,
babies are infants. I'm sorry. And the babies and infants less than 6 months, the mother's breast milk is more than enough to rehydrate the baby.
right. The next question is on the similar lines of the previous question. Hello, doctor. My son is 16 months old. He's taking fluids more frequently, but he's sweating a lot and he suffers from heat issues. And he frequently touches his private part. I'm cleaning it frequently and take him to the loo frequently, but he still does that.
Again, it requires a thorough examination of the genitals. One. Second thing, hand hygiene is very important, and make sure that the child washes his hands very frequently, because children tend to play with a lot of toys and interacting with a lot of children, touching the objects, non-nutritive objects, and all those things. When they touch those objects and then they take the hand to the genital part, definitely there is an ascending infection, localized infection. So first main important point is to maintain hand hygiene. Second thing, again, getting examined for the genitals from your pediatrician or the pediatric surgeon, understanding if everything is fine, then the local hygiene practices will definitely help.
Right. Okay.
Yeah.
Next question is, my daughter takes more juices than water. Is it advisable to compensate with juices instead of water?
See, homemade juices is always recommendable, can be given, no harm. But if the child is dehydrated, then there are certain juices or certain fruits that are not recommended to be given. That has to be avoided. Otherwise, a healthy child taking a lot of fresh fruit juices is very good and shouldn't be a bother of concern.
Okay. We have a question about how much water a child should consume. So please refer to this video after we are done with this video, because doctor has already answered this question previously. Hello, doctor. My toddler is 20 months and 3 weeks old. She drinks more milk and water intake is less. Oh, more milk and water intake is less. Only taken after meals or when she feels thirsty. Frequently, water intake is actually less. Any advices?
Okay. This is something which I commonly encounter in my office practice. Now, what happens here is, have you started a normal family pot of food for your child? Is one of the important questions. Your toddler is what we are concerned about, because normally after 12 months you should start the family pot. What do you mean by family pot is, whatever I eat, I tend to feed the same thing to my child. So that should be encouraged in the children who are more than 1 year of age. Suppose if you are doing specialized food preparations for your 20-month-old toddler, there are no adequate spices, there's no adequate requirements or essential requirements in his diet, then definitely he will not consume water. This is one of the common things which we explain in parents who are between 6 months to 12 months old infants. For them, they do not consume any of the spices, they do not consume any of the other products other than the minimal allowed jaggery. We do not give any sugars, we do not give any salt, we do not give any spices. So those children taking water is very less, because once you start natural ingredients, then this is when they start consuming water. So just check into your diet what you're giving your child. It should be a family pot. Whatever you cook for yourself should be fed to the baby. And in some babies it is quite normal. It is based on the phenotype or the body water content, that depends on how much water they should consume. So shouldn't be a worry, but make sure that you give a family pot diet.
Okay. The next question is, hello doctor, my 19-month-old kid drinks water in few sips only. How much water is required per day at this age? She is breastfed on demand and not sure how much she takes in breastfeed.
Again, if you're breastfeeding, again it is one of the source of water intake, and frequent sips at regular intervals, it should be sufficient. Again, as I told, a child are probably around 1 to 1.5 liters including all his liquid intake, and I think so it should be sufficient. You should not be having any concerns with that.
Right.
Yeah.
How to prevent loose motion occurring in babies? My friend's baby is 2 years and 4 months. Any remedies or advices?
Again, there's something called as gastrocolic reflux. In some children, it is physiological. If suppose a child is regularly passing around 4 to 5 times of stools, then it's absolutely normal not to be worried about, because some children will have this gastrocolic reflex where instantly when they consume food, they immediately have an urge to pass stools. That is quite normal. You should not be worried about it. Again, this is something which is for the age.
Okay. My daughter's first pee in the morning is sometimes mild yellow. Does that indicate she is dehydrated? What can be done to avoid that?
No, it is not considered to be a dehydration or anything like that. No need to concern. It is quite normal.
Also, does the AC and fan affect or cause dehydration in any way? Because it's
No,
prolonged exposure at night. So,
it doesn't cause. It shouldn't be a cause of worry, because we are not going to extreme temperatures, higher temperatures or lower temperatures, so shouldn't be a cause of concern.
is it okay for a 20-month-old kid to pee at night while sleeping?
Yes, quite normal. Quite normal. After 2 years you can start training the bowel movements, and then you can start slowly training them to go for all this pee and the passing of stools. But at 20 months it's quite normal not to worry.
Okay. I take my baby to loo once every 2 hours. She passes very little urine, sometimes colorless, sometimes mild yellow. Is she being dehydrated?
Again, this color has nothing to do with dehydration. And in terms of child passing at 2 hours intervals, again, it could be little exaggerated, is what sometimes we feel when parents tell like that. But normally, yeah, 7 to 8 times is quite normal in that age of children. Shouldn't be a cause of concern.
Okay. My baby is breastfed at night but still doesn't pee at night.
Yeah, again, if you're putting a baby diapers at night, I think you should have to check the diaper properly. And some children might hold the urine and at once pass in the morning. Again, as I told you, as a child age increases, it can be 2 times, 3 times, or 4 times. So shouldn't be cause of concern. You shouldn't be worried about it.
Okay. So I believe we have taken all the questions so far.
Yeah.
If
So
you have
what I
any
understand.
queries, yes.
Yeah, I'm
Doctor,
sorry.
please
I'm
go
sorry.
ahead. Sorry for that.
Yes, yes. What I understood from all these questions is most of them are physiological. They do not need any treatment. It's just a normal. See, nowadays we have got too much of knowledge coming into us. through various sources. So we tend to read each and every article or every news that coming up in these things. But most of them are physiological, quite normal, and it shouldn't be a cause of concern. And we should not give too much of thought about this.
Right.
Yeah.
Great. Thank you so much, Doctor, for answering all
Thank
these
you.
questions
Thank
in
you.
so
Thank
much
you.
of depth. I'm sure all the viewers are going to take away a lot of knowledge nuggets from this session. And it
Yeah.
being summer in India right now, and the scorching one at that, I'm sure this is
True.
going to be a very, very insightful and helpful session for all of us.
Sure.
Any ending thoughts you have for today's session?
Nothing else. I think thank you very much for the opportunity. I think most of the people have very enthusiastically have participated in this talk and asked me a lot of questions. My only advice is whenever you're in the point of summer, I think make sure that the child takes adequate liquids. It can be in form of any juices, liquids, and any sort of tender coconut and total intake. And if the child suffers from any diarrhea or vomiting, just make sure that you rehydrate them. And if you're not able to rehydrate them, and if you see any signs of dehydration, just consult your pediatrician. He will be the right person to help you out in these situations. Thank you.
Thank you so much for taking out
Thank you.
your precious time and being with us here over here today. Thank you
It's
so
my
much
pleasure.
to all
Thank
the
you. Thank
tribers
you.
for Thank you so much to all the tribers for tuning in. Stay tuned for more exciting sessions just on Parent Tribe with SuperBottoms. Thank you so much.
Thank you.